Hello guys, let's start from the humerus. First, we have to understand their basic knowledge, that is the anatomical views, in which we have the anterior view and the posterior view. In anterior view, we have head, a greater tubercle, lesser tubercle, anatomical neck and a surgical neck, intertubercular sulcus. In the end of the humerus, we have the radial fossa, coronoid fossa, lateral epicondyle, medial epicondyle, capitulum, and the medial edge of the trochlea. Let's understand these one by one. Head. It is the round and covered by articular hyaline cartilage. Then we have greater tubercle. On the greater tubercle, the three muscles are attached. First, the supraspinous muscle, infraspinous muscle, and the teres minor muscle. On the lesser tubercle, we also have a one muscle that is known as the subscapularis muscle. In between the greater tubercle and the lesser tubercle, we have the intratubercular sulcus. The intratubercular sulcus contains the long head of the biceps, and this is the lateral lip and this is the medial lip. On the lateral lip, there is a pectoralis major muscle, and on the medial lip, there is the teres major muscle. On the medial lip, we have the teres major muscle, and on the greater tubercle, we have the teres minor muscle. And the floor of the intertubercular sulcus, we have the lactimus dorsi muscle. Then forward to the anatomical neck or the surgical neck. Anatomical neck provides attachment to capsular ligament of the shoulder joint. What is the capsular ligament? Capsular ligament connects the humerus to the glenoid cavity. Surgical neck. Surgical neck is the common site where the humeral fracture. It is the common site where the humeral fracture and the axillary nerves is rounded. Then there is a deltoid tuberosity. In this the deltoid muscle are attached, and this is the medial border, this is the lateral border, and this is the anterior border of the humerus. Then there is a radial fossa or the coronoid fossa. What is the difference between the radial fossa and the coronoid fossa? In radial fossa, the head of the radius during the full flexion occurs, and in the coronoid fossa, the coronoid process of the ulna during the full flexion occurs. Then this is the lateral epicondyle and the medial epicondyle. And this small ball-like structure is known as the capitulum, which articulate the head of the radius, and this structure is known as the medial edge of the trochlea, which articulate the trochial notch of the ulna, and the ulnar nerve is articulate from the posterior surface of this medial epicondyle. Then we have the posterior view of the humerus. It also have the head, anatomical neck, surgical neck. Then there is the oblique ridge. This is the lateral border and this is the medial border. And the groove of the radial nerves and the deltoid tuberosity. Instead of the radial fossa or the coronoid fossa, the posterior view also have a fossa. But there is only one fossa, that is known as the olecranon fossa. Let's understand from starting. Oblique ridge, it is the origin to the lateral head of the tricep bronchi, and the groove of the radial nerve where the radial nerve is originated. Then there is the one fossa that is known as the orycranon fossa. It is also same as the radial fossa and the coronary fossa, because in the orycranon fossa there is the orycranon process of the ulna during the full extension occurs. Thank you for understanding. If you have any doubts regarding this topic, please leave your questions in the comment box and I will provide you answers. And the notes of this topic is attached to my WhatsApp channel.